G'day, and welcome to the AHDC podcast series, Health Design on the Go. I'm your host, David Cummins, and today we're speaking to Adjunct Professor Warren Kerr, AM. For over 21 years, Warren has been the National Director of the Health Portfolio for National Architecture and Planning Practice, Hames Charlie. Welcome, Warren.
Thanks, David. Good to be with you.
You have had a very interesting career over the last 20 plus years. You've obviously made quite a big impact into the world of health design. Where did that passion come from?
I've always wanted to be an architect since I was about 10 years old, but my career direction was set when I won a Commonwealth cadetship during my architectural studies at the University of Western Australia. My specialisation in the planning and design of hospitals commenced early in my architectural career when I was invited to design an outpatients clinic for a repatriation hospital and then major extensions, including wards and theatres. When I graduated, I had a position within the Commonwealth Department of Works in Perth, and as luck would have it, I was assigned to the hospital's design group, who were then looking at the redevelopment of the repatriation general hospital at Hollywood in Western Australia. After doing that for a few years, I was then promoted to a specialist hospital design group in Canberra, where I had the opportunity to work with some of the best architects in the world in healthcare planning. I ended up becoming interested in research because I was assigned to the National Hospital and Health Services Commission. I also became involved in advocacy through the Institute of Architects. After working in Canberra in this field for a few years, I came to understand that I needed greater specialisation in my career, and that led me to undertake a Masters of Health Administration.
That is a lot to take on board. What year did you finish your architecture degree?
I graduated in architecture in 1974 and then commenced with the Commonwealth Department of Works in that year.
Yeah, even more recently, I'm actually doing a lot of research myself on health design in Australia, and still as a profession, they say it's actually one of the least researched professions in the world, although that does seem to be changing dramatically. So back in the 1970s and 80s, how did you know what was best practice?
Absolutely, and an unfortunate aspect, but you're quite correct that the architectural profession is way down on the research scales. Because of my interest in research, I've also become involved in university education and research. And as you mentioned earlier, I'm an adjunct professor at the University of Western Australia, have been a visiting professor at the University of New South Wales. During my period there, I worked with Jane Carthy to set up the Centre for Health Assets Australasia, which made a huge inroad in setting up research protocols for the hospital planning and design sector, and also resulted in the creation of the Australasian Health Facility Guidelines.
So getting back to the 1970s and 80s, how did you design buildings back then? What was the evidence to support the design?
When I was selected for this specialist hospital design group, one of the preeminent architects in the Department of Housing and Works responsible for hospital design had set up the Hospital Architect Training Scheme. And that took architects who are interested in this field out of their day-to-day designing role for 18 months to 2 years and put us into hospitals so that we could actually work in all the various departments of a hospital. And that gave me a great understanding, basically empirical research, so that when I went back to designing hospitals, I had that hands-on experience and therefore knew what was required in each of the areas, and more importantly, knew what I didn't know and therefore when to ask questions. Early in my career, I discovered that many of my clients didn't have a good understanding of the project design and planning process, but they also didn't have an understanding of how to design healthcare systems. That was the reason I took the decision to undertake a Master's in Health Administration. One of the aspects that came out of that was a change in my design philosophy. Up till that point, I had thought that I would be best designing the best building for a group of practitioners to then undertake the delivery of healthcare services. But after that, I decided that I would be best off designing the healthcare system in conjunction with my clients, and then the building is part of the enabling factors for that, just like a scalpel in a surgeon's hand is part of the enabling factor to enable him to deliver his services. So rather than the building being the preeminent task, it was the design and delivery of the healthcare system and how that could be best undertaken within a building.
You touched briefly there about research. How important do you think research is for health design? It seems like Australia, if not the world, is maybe 20, 30 years behind where you were in the 1970s, 1980s. And it's only now where good research, good innovation is coming through that does actually have that clinical support for patient care.
I think research is absolutely vital. And as I said earlier, one of the outcomes of setting up the Centre for Health Assets Australasia, which was the first national research group established in Australia to look at this particular field, resulted in the Australasian Health Facility Guidelines. And that has been fundamental in assisting all architects to have similar standards, similar goals, similar opportunities, and a, a basis from which they can then either enhance or deviate, but according to a known basis. And from my point of view, it is a great outcome that I think I'm very glad is now being continued. I would like to see a new National Centre for Health Research, and through the Australian Health Design Council, we're obviously endeavouring to raise the profile of research in this sector of our industry.
Yeah, I agree. There's actually now a new journal. I think it's called Health Design, which is a very good journal. And there's even now some great books. I think that one of them is called Health for Design. So there's actually all these new books and journals coming out, which have only been in the last 4 to 5 years, which again, for someone that's been building hospitals for over 30, 40 years, you're way ahead of the curve.
Well, one of my colleagues, Kirk Hamilton, he decided to set up the Health Environments Research and Design Journal in the United States as the one go-to source for articles on the planning and design of healthcare facilities. They kindly invited me to be on their advisory board.
I know you've done a lot of research yourself. Do you mind telling our listeners about some of your personal research and how it's helped improve you as a practitioner and your health design of your projects over the last few decades?
Certainly, very happy to talk about the personal journey I have in working with the people like Roger Ulrich and Kirk Hamilton. We had the opportunity to get Roger Ulrich involved when we were doing the design of the new $2 billion Fiona Stanley Hospital in Perth. When we received the brief for that hospital, we had the normal brief at that time in Western Australia, which was a mixture of single rooms, 2 bedrooms, 4 bedrooms, etc., which resulted in about 23% of the patients had the opportunity to be in single bedrooms. Roger, on the basis of the research that he'd undertaken, suggested that that should be amended. He made a recommendation to our client, the WA state government, that they increase that to 80% single rooms. They looked at the research that Roger was able to provide and the reductions that he could show in length of stay and having a reduced likelihood of disease transmission, etc., and agreed that they should proceed with that. So the brief was reformulated, and Fiona Stanley Hospital was the first major hospital built in Western Australia which had primarily single bed rooms. So that's one clear example of the impact that research has had on our practice in designing major hospital facilities.
That's a really good example. What would be some of your favourite teachings from your research?
I think there are very specific areas that come out in terms of the relationship between hospital beds and the ensuite facilities that are normally provided in those, and they're better described with a drawing and an image so that you can understand what I'm making. But for many, many years, people in hospital design had beds in rooms with the ensuite across the room, and similar to many hotel rooms, etc. Research then found that many patients who were trying to get up during the night to utilise the facilities in the ensuite were collapsing between getting out of bed and getting to the ensuite. Research dictated that it was far better to have the ensuite facilities near the bed so that you could hop out, grab onto a handrail if you needed it, and guide yourself round to the entrance to the ensuite without incurring any falls or slips that may end up with you staying longer in hospital.
That's a really good example of what not to do. Keeping that in mind, then, how come some designers and some hospitals still get it wrong today?
I think a lot of that is basically on the basis that many practitioners don't have the knowledge and skills and experience that some of the more senior practitioners have. It takes many years to become competent in this field. There's a lot of learning to do because you're looking at bridging both the professions of architecture, health planning, research, and hospital operations. With technological change, it's a lot to keep up with.
I think there is certainly a vast opportunity for people to listen and learn from those that have built and those that are about to build as well. So I do think that's why it's such a complicated beast that really is a team effort to try and get it right.
Yeah, and I mentioned earlier that one of the other phases of my career I've been quite involved in is the advocacy side of architecture. And through my efforts with the Institute of Architects, I've ended up becoming the national president. And during that period, had some very interesting discussions with architects who believe that they can design any type of building, whereas I've always been a preeminent advocate for the fact that the best practitioners are going to be those who specialize in this field. We've had some good discussions to articulate that point of view, but it's now being recognized around the world. One of the other honorary roles that I undertake is being Australia's representative on an international forum set up under the auspices of the World Health Organization and the International Union of Architects, where we share information on hospital planning and design between 70 other countries. That allows me to have an understanding and a perspective on how other professions in other countries of the world are pursuing this particular sector and improving their skills in health facility planning.
What do you think the future of health design is going to look like in the next 30 to 40 years?
I think the major issue is just going to be the speed of change. When I started in my career, you were often asked to undertake a hospital project. You worked very closely with the clients and over a period of years gave them a new building. And then there was almost a parting of the ways because you then knew that you probably wouldn't be seeing them for another decade or so before they would need to alter any of the buildings, the facilities, etc., that they required. However, now you finish a building, and within a couple of years, the rate of change and technological changes mean that there have been improvements, and therefore the hospital needs to be almost in a constant period of upgrade and evaluation of having the latest information on the latest technology. Many of the larger hospitals in the US and Canada now employ a healthcare architect on their staff just to keep them up to date with what facilities they need and how best to accomplish that within the infrastructure that they have currently.
It's very impressive, especially to look at some of the research that's coming out from overseas, but also some of the research that's coming out from Australia. What would you say is one of the words of wisdom that you would give for people in the industry who really just want to try and make it work and really get involved in this industry and also have a long 45-year plus career like you have?
Well, I was very fortunate in my initial placement with that I ended up with a good mentor and someone who was at the cutting edge of hospital planning and design in Australia at that stage. So I would suggest for a person just starting out on their healthcare design and construction careers to find a good mentor and also to gain additional qualifications in healthcare planning and design. I'm currently attempting to set up a master's in this field in conjunction with my colleagues at Texas A&M. There is no master's program in hospital planning and design in Australia at the moment. Obviously, the other advice I give people starting out in their careers in this field is to join the Australian Health Design Council and get actively involved in our activities.
Warren, we're out of time, but I did want to say thank you so much, not only for your time, but also for your effort and dedication to the industry. Certainly, you are a global and Australian leader in this space, and I think the Australian healthcare design and construction industry, thank you very much for everything you've put into this effort. Thank you very much. You have been listening to the Australian Health Design Council podcast series, Health Design on the Go. If you would like to learn more about the AHDC, please connect with us on our website or LinkedIn. Thank you for listening.